Precision Personal Training. Here, Work It Wednesdays. We're going to kind of connect the dots today between all the work we've been working on the past month in January with core and connecting it with the importance of the strength and mobility at your hips. So today, when we get into it, we're going to work on just 4 exercises, just primarily focused on keeping your hips mobile and stable. If you haven't seen our videos yet on Facebook Live, we have Mondays, Metabolic Mondays with Lacey, usually about 6:45 p.m. It's been just kick butt cardio, big calorie burn, kind of full body workout that you can do in 10 minutes or less. So join her Monday evenings, 6:45. Of course, Workout Wednesdays or Work It Wednesdays with me, 7:45. This month of February, we're going to be working on, again, mobility, stability, and the importance of your hips. And then Saturday mornings, of course, with Erica, she has her eating psychology sessions, which will be primarily focused on your eating habits, your life story with eating, and how to use some behavioral change strategies on improving your eating. That's Saturday mornings at 9 o'clock. But today, I want to talk about the importance of your hips. And in the last month, we've been really focusing on the importance of your core. We talked about the ranges of motion, the importance of the stability with all of those, and the function within those ranges. So if you've missed them, please scroll through our Facebook page, Precision Personal Training, and check out the videos that we have already posted, because our hips really can't support us well if we don't have a sufficient core. And I won't be able to fully stand up so you can't see me, but if I were to kind of walk around and my core wasn't functioning properly as I'm kind of striding through, my body's going to try to fight to find where it needs to be centered. And again, if my TVA, that deep inner core stability, my obliques kind of firing as I'm walking around, if those aren't really working or activating properly, then our hips are going to have to kind of tighten and start restricting motion just so we prevent all of this kind of rotation and jarring, especially in our lumbar spine. If we start losing mobility in our hips, where does it have to come from? Probably our lumbar spine. So it's kind of this vicious circle between stability and strength and function of your core and the mobility and function and strength of your hips. So again, check out the videos in January if you haven't seen them yet, because those are kind of a precursor to what we're going to continue doing in the month of February, talking about our hips. But today I want to give you 4 exercises for you to use on increasing the mobility at your hips. Next week we're going to talk about the difference between mobility and flexibility, which there is a little minor difference and a very important difference. So definitely stay tuned for next week, because there is kind of an important key that I want you to think about. After we're stretching all of our hips, we want to make sure that we're also supporting the strength within it. If we just have a lot of loose range of motion, then that can kind of increase your chance of injury. But we'll talk in greater detail next week. So again, follow along with me each week as we kind of progress through those motions, especially on hip and core stability right now. So with our 4 exercises today, I'm going to talk about a little bit about our function in the hips. So commonly when we do our first client assessments, we do a long posture assessment and movement assessment. We do this because we want to see how our clients are moving before we even start prescribing them an actual fitness regimen. And the one thing that we see almost all the time, I mean probably 3 out of 4 clients have what's called an anterior pelvic tilt. And I'll try to kind of tighten up here. An anterior pelvic tilt is when my hips are rolling forward. So if I were to have kind of a cup of water here and I were tilting that glass, kind of pouring the water in front of me, that's an anterior pelvic tilt. And we get that if we're kind of seated for long periods of day. Our hips do what's called adaptive shortening, especially our psoas, this deep hip flexor muscle, can shorten and tighten over time because we're constantly in this seated position. And that muscle runs from the top inside corner of our hip and runs through kind of our stomach region, our abdomen region, and attaches lower on those lumbar vertebrae. And if that muscle gets really short and tight from this kind of seated, compressed position all day long, as soon as we start to stand up, our pelvis doesn't have that mobility because that muscle has adaptively shortened. Our body's been in that position for an extended period of time, or day after day after day if you're working at the office. And it has the need of needing to stay short because it doesn't really have a reason to be long. And so our hips roll and adapt to that position causing what can be a little lumbar tension, some tightness in our hips. A lot of us feel a lot of tension in your calves too, which can be caused from that anterior tilt. So a lot of exercises that we're going to do today are going to be focused on releasing there and also enabling our legs and our hips to work more independently of one another. So the first exercise I'm going to give you is, if you go into a kneeling position, I'm going to bring my foot up just slightly on the wall, and I really want to make sure, hopefully you can see me a little bit, but making sure you have what's called the posterior tilt. So trying to tilt that glass and pour the water behind you. So tuck the hips, squeeze your glute, especially on this back on my left leg, and I'm going to press forward. So I should feel a stretch right at the top inside corner of that hip, maybe running down into the quad if you're really tight there. So we're going to hold these stretches. I've got our clock going for about, honestly, if you could hold for 1 to 3 minutes or so, that's kind of enough time for your central nervous system to really adapt to that stretching, start communicating with those muscles about, hey, this position's okay. That would be ideal. We don't really have that time this morning for it, so I'm just going to hold for about a minute. So as you go back and do these stretches again, make sure to hold for about 1 to 3 minutes would be ideal. And we can go, of course, switch to the other side. Tucking the hips again, squeezing the glutes on my right side, and driving forward. The other thing you can think about in this position too is trying to draw this heel towards you. So this front leg kind of pulling in towards you. It's not moving, but we have that activation in the hamstrings really drawing that in. Nice deep hold. After that, we're going to go into just a nice glute stretch. So if you think about the motion that we do, the most common in our hips is kind of in this sagittal plane, right? Just kind of coming up and down. But our hips have so much more ranges of motion through that. And if we're constantly working here, then we're not really enabling our body to create stable and open ranges of motion at that hip. So this exercise here, we're going to put one foot on the wall, the other foot's going to cross over, and I'm going to sink down. I want to make sure your low back is nice and soft on the mat. So if you have to, you can always slide back. If you want a deeper stretch, you can always slide closer to that wall. And if you need to, you can use your hand here, kind of pushing that knee away from you to get a little assistance if you need. A lot of us are really bound up in those glutes, those deep six muscles that piriformis. If you have some sciatic pain, sometimes this brings relief to people. So let's go and hang out here again for about, a solid minute. So I think we have about 30 seconds left. And of course, we'll try the other side as well. It should feel that nice deep stretch in the glutes. I might even run up into kind of that TFL, IT band down the leg if you're really tight. Just kind of breathe and relax. We'll switch to the other side. We want to make sure you're not really overstressing that stretch either, or overstressing those muscles. You're really just kind of coaxing them into those ranges of motion. If your body starts sensing that, sense of pain, or, oh my gosh, this is too much, it'll restrict that stretch and kind of protect itself. So you want to make sure you're kind of asking that body for the stretch. It's okay, we've got this, it's an okay position, and it'll definitely relax for you. Our next one is going to be on all fours. So I'm going to go kind of in like a child's pose-like position. But what I'm going to do first is make sure I have a nice flat back. So as we talked about with that pelvic tilt, we want to make sure that's away. So tuck the hips, nice straight spine. I'm going to bring my left hand and my left knee just slightly forward, and I'm going to tuck the toes on my right foot. So this is an easy one to remember. If your back leg, tuck the toes. So left side is slightly forward from the right, and I'm going to rock back and forth into that deep child's pose position and coming back up. The biggest key with this one, well, there's two. One, preventing, of course, as you come back, that we're not rounding. So staying nice and flat in that spine. And the other one, too, is not shifting off to one side. Your body's going to want to kind of sink off to that other side. But this is where we're trying to work on the independence of your legs and your hips. You can switch sides, maybe do about 10 or so of these. I'm going to have now my right knee and my right hand just a few inches. It doesn't have to be far. It's maybe 3 or 4 inches. And sinking back and forth. Nice flat back, no arching, no rolling, just straight back. Begin about 10 per side. And while you do your 10, I'll describe that range. So our hips slightly have this ability for one side to roll forward and back, and their pelvis has very subtle. This is an extreme exaggeration, but if I had one side of my pelvis here, the other side here, they can slightly work independently of one another, where one side turns forward and the other turns back. Now that pubic symphysis is, pretty strong, so it doesn't allow for a lot of range, but it's there. So by using that little stagger child's pose rock here that we were doing, that can help encourage that stretch. And the last one, same concept, encouraging that independence of your legs, your low back. I'm going to go wide knees, as wide as I feel comfortable. My toes in the back are together, and you can start on your hands if that's more comfortable, or you can go down to your elbows if you have the range. And I'm going to sink back as far as I can with a nice flat back. Should feel a stretch on the inner thigh. As I come forward, I'm going to kick one leg open. When I drop back, I'm going to alternate to the other side. So each time, I'm just switching legs, kicking out, and dropping back in. So you're getting great ranges of motion, not just that sagittal plane like we talked about with the walking or repetitive patterns. Here, sinking back, getting a nice deep internal rotation at the hip, sinking back, nice external rotation, and just flowing through. So again, try about 10 of those per side. So if you just joined us, and we've got a couple people, hopefully you guys are stretching with me, rewind back, check out some of the stretches that we did, 4 stretches to increase the mobility and integrity of your hips.